channel. If you are new here, my name is Frey, and here on this channel I strive to break stigmas, specifically on a couple of things like cannabis, OnlyFans, and festivals. But today I am going to be going over a cannabis topic, specifically what cannabis can do to help relieve PTSD symptoms. It's extremely important that we recognize the medical ability of cannabis as well as just the recreational love for it. But it is very real for medical purposes. It is very helpful, and I wanted to go ahead and dive into a new series here for Terpene Tuesday, which is going to be going over the different qualifying conditions for getting your medical cannabis card or medical marijuana card, whatever it is called, wherever you are. So I am going to be going into a few different things. I do have my notes here up on the screen, and we're just going to have a little smoke sesh hangout. That's why we're here in the cozy corner again. So I hope that this can be helpful for you or for a loved one to help break a stigma, help educate, help learn. Maybe it can help you a little bit throughout your healing journey and your journey of just figuring out what works for you and your body. So without further ado, let's go ahead and dive right into it. So first of all, what are the symptoms of PTSD? What are we trying to medicate when we talk about post-traumatic stress disorder? A lot of people don't have a proper understanding of post-traumatic stress disorder. Even my own cannabis doctor, which I'm getting a new one, debated my diagnosis with me, essentially, as if I was not diagnosed by an actual doctor. So it was a little bit frustrating, and I understand that PTSD is very stigmatized, especially for younger people, younger women as well. So I just wanted to go over just what is PTSD, what are the symptoms, etc. So coming off strong with the behavioral symptoms, so we have agitation, irritability, hostility, hypervigilance, self-destructive behavior, and social isolation. So all of these things can be present, or just one or few of them. The diagnostic criteria for PTSD is in the DSM-5. If you, the DSM-5. If you would like to go and look into that, I do believe that they are adding CPTSD, which is complex post-traumatic stress disorder, in the new book that they are writing, the new diagnostic criteria book that they are writing. However, it's not currently in the diagnostic criteria book, so it's just PTSD. However, with complex PTSD, almost all of these behavioral symptoms are present in almost every patient that I've seen in the records. Again, I'm not a psychologist, I'm not a doctor, so this is just based off my own experience and off of the literal diagnostic criteria of PTSD. So moving on to the psychological symptoms of PTSD is flashbacks, fear, severe anxiety, or mistrust. So again, all or few of these will be present as symptoms in a PTSD patient and can be something that they are looking to medicate. Next, we have the mood symptoms, which is loss of interest or pleasure in activities, guilt, or loneliness. A lot of times these symptoms can be treated with cannabis in order to help someone find the creativity in their day to possibly pick up music again, or dancing, or singing, or whatever their hobby is that they would normally have a love and interest in, that because of the traumatic event that they have experienced, or traumatic events that they have experienced, they have lost that interest and that pleasure in those things, and cannabis can just help with those, and we'll get into that later in the video as to how specifically cannabis can help with that. Moving on to the sleep symptoms, you have insomnia and nightmares. Common times you have patients waking up from nightmares. I personally experience a lot of nightmares, a lot of insomnia. Cannabis can really help with that, especially RSO for those who have severe insomnia. RSO gummies, RSO syringes, rosin gummies even could help so much with the insomnia and with the nightmares and just providing a nice sleep for the patient. Again, I'm getting ahead of myself with already naming different things to try, but moving on, that's the sleep symptoms. So some other common symptoms as well would be emotional detachment and unwanted thoughts. So that kind of comes in with the flashbacks and the nightmares. Of course, those are unwanted thoughts, and the emotional detachment with the losing of interest and the losing of pleasure in activities, with the guilt and the loneliness. They all kind of coincide. And again, please don't diagnose yourself. Please do get diagnosed by a professional, because a lot of these symptoms can do actually overlap with other mental illness symptoms. So I would say to definitely, if you have it available, because I do understand that it's not easily accessible in this country. So if I fortunately got diagnosed when I was a minor, so I was able to get that diagnosis under state insurance when I was a minor. However, I understand that as adults it is extremely difficult to get diagnoses. Just of course, medicate and target the symptoms that you specifically need to target. But as far as diagnoses, don't self-diagnose, especially on things like this. Make sure that you talk to the proper people. So moving on to kind of what PTSD does to the brain, and this is what you're going to be treating when you are treating when you are treating PTSD with cannabis. And this is part of my job as a bud tender, is to know these things. But I did list off a few bullet points that kind of go a little bit deeper into what PTSD actually does to the physical brain. Most PTSD patients know this and don't need to be mansplained it, especially when they're coming in just to get their medication. This is just things that I need to know, just to be aware of as I'm helping out patients picking out their medication. However, for you, I'm just going to give a brief breakdown of a few things, and if you need to Google a few things, pause the video, go Google it, and come back, okay? So going into what PTSD does to the brain, the amygdala causes the adrenal glands to release the hormones and the hormone adrenaline and cortisol into the blood. So basically, the adrenal glands will release adrenaline and cortisol, and that will cause stress to the body, not only to the body but to the brain. And with the amygdala, unfortunately, we'll go deeper into it, but it is affected by PTSD. So the cortisol and the adrenaline levels of someone with PTSD are a lot higher, and cannabis can really just help lower those stress hormones and allowing yourself to relax for a minute and get out of the fight or flight mode that your body is being put in. So the hippocampus is involved in memory, learning, and emotion. Its largest job is to hold short-term memory and transfer them to long-term storage in our brains. So it also plays a role in emotional processing, including anxiety and avoidance behaviors. And as we just learned with what PTSD symptoms are, your emotions are highly affected, and so are your avoidance behaviors. Your avoidance behaviors are heightened. You almost avoid people that love you and want to be there for you, simply because you don't really know what to do. Your body is so stressed out, you don't have the room to hold those people. Same thing with the activities and interests that you previously had before said traumatic incident. So unfortunately, with the amygdala and the hippocampus being affected with PTSD, it causes your body to just be like stuck in the fight or flight mode, and it causes a huge disconnect really from your emotional self and your personality and your life, and it causes a huge divide, not only for yourself but for the people around you. And it's not your fault, of course. You went through a traumatic situation. But, you know, it's definitely something that is affected, and unfortunately, so is the medial prefrontal cortex. That's also affected by PTSD, and that plays an important role in generating appropriate social responses by supporting behavioral flexibility, response inhibition, attention, and emotion. So basically what that means is that the medial prefrontal cortex, which is what we all talk about, gets fully developed at 25. Not everyone has theirs fully developed at 25. You could be autistic, ADHD. That delays it. So does PTSD. PTSD actually causes the medial prefrontal cortex to become almost enlarged, hyperactive, causing basically very inappropriate social responses, so with someone with PTSD, you might see them pop on something that typically is really small to everyone else. To them, it's super big, and they might pop their fuse, pop their top, whatever you want to say. And that isn't necessarily the appropriate social behavior for when someone is overstimulated or upset about something. Typically, it's to approach the situation maturely, have a conversation, etc. Typically, someone with PTSD will struggle with things like that. As well as, the behavioral flexibility. That basically just means when you're upset with someone, it's hard to not stop being upset with them. So it's hard to be flexible in the behaviors. Typically, those with PTSD get kind of stuck in that emotion for a hot minute. Everybody's different, of course, but yeah, PTSD has a lot to do with your emotions. So cannabis. What can cannabis do to help PTSD? Now we're going to dive into what cannabis can actually do and what cannabis does for the brain. Make sure to hydrate. Okay, so cannabis decreases the hyperarousal and intrusive memories by activating the CB1 receptors in the hippocampus. So, as we just learned what the hippocampus is responsible for, cannabis can actually help the hippocampus calm down to allow the patient or you to kind of receive a little bit of relief from those flashbacks, from the anxiety, the overworked kind of feeling, just like the uppity feeling. The cannabis can really just help release that and relax that emotion and that feeling by activating the CB1 receptors. And if you're having a hard time understanding CB1 receptors, CB2 receptors, etc., the things I'm going to be going into, I do have a few videos that go into that, and I will link them at the end of the video. So cannabis also allows the brain to reduce and moderate the outbursts of traumatic memories. So this is extremely important for PTSD patients to be able to live somewhat normal day-to-day life and to be able to go to work, to be able to have friends, to go out and do social things. This really allows patients to feel somewhat normal while also understanding that they have healing and a journey to go through. And as well, I will say that you do have to moderate your cannabis usage, and we'll go into that when we go into CBD, because you don't want to numb out your emotions either, especially when you have PTSD and you're trying to heal from that. And again, your doctor, your psychologist, your psychiatrist will go into this with you, when on your terms, because everyone's on their own healing journey. But the overusage of cannabis can cause you to really just ignore dealing with some things that you have to deal with in order to heal. Obviously, sometimes you need to ignore those things in order to get the workday done or whatever, but when it's time to heal and you have that downtime, you don't want to use cannabis when you're in the process of therapy unless your therapist suggests it, because you really want your brain to be open, because of the fact that cannabis can really by activating your CB1 receptors, really mellow you down and prevent the memories coming up that you actually need to think about in order to heal. So just keep that in mind. So cannabis also allows patients to feel relief from anxiety, depression, and insomnia caused by their PTSD. Like I was talking about earlier, RSO gummies, RSO syringes, rosin gummies, those are really nice, especially the indica ones. Super nice for if you struggle with insomnia, especially severe insomnia. I will say sometimes you can wake up a little groggy still, so start with half a gummy. I would even say a fourth of a gummy if you aren't used to it, and I would even say start with a regular distillate indica gummy before you go to RSO and rosin. And then I would go to rosin before RSO. However, for me personally, I kind of need the RSO in order to go to sleep and have a good night's sleep without any interruptions. Of course, my cat, I haven't tried RSO since getting my cat, and my cat wakes me up quite a lot at night. But as far as nightmares goes, the RSO really helps with that and my level of insomnia. So that's kind of what cannabis can really help with, as well as it can. So people that have PTSD have a hyperactive amygdala, which worsens the symptoms, and we went over what the amygdala does, but that's why cannabis can be extremely beneficial for those with PTSD, to help calm down all of the parts of the brain that are hyperactive due to PTSD. So just make sure that if you have PTSD and the other medications that you're trying aren't working, maybe try or aren't giving you the satisfaction that you desire, talk to your doctor about maybe trying cannabis. Now we're going to go into what CBD can really help with PTSD. So CBD, and we are talking about the medical dispensary grade, because the grade that you get when you're talking about buying it from a head shop, it's not going to have the level of THC that is really going to benefit you. The legal amount is 0.3% of THC, and that just simply is not enough in order to get the benefits and the entourage effect that you need in order for CBD to really help you with your PTSD. Honestly, I don't like those hemp products at all. But I understand not everyone has the money or the ability to get a medical card. It is quite pricey. However, I am going to be only talking about the medical dispensary grade CBD that you can get at any cannabis dispensary. So this type of CBD may cause the hippocampus to grow and reduce the hyperactivity of the amygdala. So with that being said, the hippocampus, as we talked about previously, you want to make sure that you are being very careful with the things that you're trying to change about your brain, because of course you're going to change. So when you're ready for that change, take that change. But CBD can help a lot with just making sure that your hippocampus, it's not a guarantee that it can cause your hippocampus to grow and will allow your amygdala to not be as hyperactive. However, it is a possibility, and that's at least something worth exploring, is what I'm trying to say. Again, what I'm trying to say is, with cannabis, with plant medicines, with any medicine, nothing is guaranteed. It's all a trial and error basis, and you want to make sure that you're really figuring out what works best for you, which is always why I recommend keeping a cannabis diary, so that way you can kind of like write down, okay, this worked for me, okay, this didn't work for me, and kind of go from there, because every single body is different, and I keep wanting to give my personal experience, and it's tripping up my words, but I can't give my experience necessarily on a lot of things, because every body is different. So I will say there's a lot of things that CBD has helped me with. I love CBD. I personally am a huge advocate for it. However, it's not always going to help everybody when it comes to growing the hippocampus. However, CBD can and does help with helps to mediate symptoms without providing that high feeling. So it can be used in conjunction with your flower, vapes, concentrates, etc., without having to worry about overdoing the THC. And the amazing thing about THC and CBD is that if you ever do feel too anxious or like you've done too much THC, CBD helps mellow it out to where you won't have to really worry about that, and it will help really bring you back down without ruining your high. It won't turn off the high, but it will bring you back down. So overdoing THC can cause anxiety, which is the opposite of what PTSD patients need. So again, that's always why I say have some CBD on hand, because CBD and THC do at the end of the day work best together and give you the entourage effect and give you just a much better experience. So moving on to suggested products, this is just a few things that I personally would suggest to someone with PTSD that's coming in, brand new, has never tried cannabis before at all to treat their PTSD. This is what I would recommend. So I would recommend, first of all, a CBD tincture of some sort. I'm not affiliated with any brand that I'm showing, by the way. These are just the brands that I happen to have readily available. So a CBD tincture allows for the product to be absorbed directly through the mucous membranes in the mouth. So you take a full syringe of this and then you drop it under the tongue. I personally like to use a chaser after because it does not taste the best. But I do use a little chaser after and it works wonders. I do 1 to 2 full droppers once or twice a day, depending on how bad my symptoms are, to be honest with you. So moving on to terpenes, the terpenes that specifically help with PTSD the most is myrcene, limonene, serapholine, and lionol. So these terpenes specifically give you a relaxed yet uplifting effect to possibly fight the symptoms of depression and anxiety that's caused by the PTSD. A lot of these terpenes are going to be found in hybrids and indicas. A lot of these terpenes are not going to be found in any kind of sativa, just because sativa really will cause anxiety for some people who already have high levels of anxiety. Sativa can cause anxiety attacks, panic attacks, and that's just not really beneficial for someone with PTSD. So that's why we typically will recommend an indica or a hybrid for someone with PTSD or someone with high anxiety. So what are some kinds of flowers I would use? So if you're trying to grind up flower and do your medication this way, or you can combine the two, like I said, with the tincture. Because it's CBD, you can combine it with your cannabis flower or with your concentrates and vapes and it not be a problem at all. But some flowers that I would recommend for someone who's trying to treat their PTSD is Granddaddy Purple, which is an indica, OG Kush, which is an indica. Again, most of these are indicas or hybrid. And then the last one is an indica dominant hybrid. It has a few different names that you can find it. Is Dosi-Do, also referred to as Dosi-Do, Dozy, or Dosi-Dose. A lot of different spellings for it, but you get the vibe, you get the gist. So that's some flowers that I would recommend. Next, on concentrates, I really only have one specific concentrate that I do recommend for any PTSD patient to try, and that is THCA. Geez, if I can speak. So I don't have actual THCA, unfortunately, but I do have a box from THCA that I've purchased before from Blue River. And this is a hybrid. Blue River has amazing THCA products. And I'm just going to show you here if it focuses. It's going to focus. Hold on. There we go. Okay. So THCA works to relieve inflammation, pain, and is an ideal cannabinoid for treating symptoms of such conditions such as arthritis, seizures, which a lot of PTSD patients experience due to the effects psychological conditions can have on the physical body. So you definitely want to give THCA a try if you ever have the ability to. THCA crystals are amazing in my opinion. They come in a little Terp sauce to where they're really tasty as well, and they just provide an amazing relief, not only internally, but just in your brain. I don't know how to explain it. It makes your brain feel less heavy, less crowded. It makes your brain feel a lot lighter, while also relieving all the pain that your body is experiencing from the high cortisol and high adrenaline levels of being in fight or flight mode of the PTSD, or due to the PTSD. So it's genuinely something that a lot of people don't know about, a lot of people don't try, because it is a little bit on the pricier end, but it is worth giving it a try. Even if you use it super sparingly, give it a try. So that is pretty much it as far as information that I have for you. So if you're finding that the other treatments that you're using for PTSD, or that your loved one is using for PTSD, are ineffective or coming with their own set of side effects, talk to your doctor about trying medical cannabis and CBD, because it could really benefit your life astronomically. If I can speak today, can you tell I can't fucking speak today? As it has mine. As you can tell, I have a lot of cannabis products because they do genuinely help my life so much. Like, I don't know what I would do without cannabis. That's why I am here to help break the stigma and educate people as much as possible as I can. Because honestly, many people find relief from cannabis, and I feel like you should too. And the stigma on it is just stupid. But honestly, this just makes your healing journey easier. And if your work prevents it, look into getting a medical card, because at that point they can't prevent it. I believe, fact checked me on that one, okay? Please fact check me, because it depends on your state. But we are going to take a glob together in celebration of Terpene Tuesday like we always do, in order to end out the video and end out the night. However, I am very thankful for every single one of you for being here, and I hope that you're able to find something useful from a Terpene Tuesday video. I love making them. It's my 9 to 5 to educate people on cannabis and to help people pick out their medication for, you know, all these qualifying conditions that I'm going to be going into. And, you know, that's the new series we're doing. I'm very excited. And, you know, I do understand that a lot of people don't understand or don't believe that cannabis can be a medical product and that it can actually help. And I understand that a lot of people, in your life may be like, oh yeah, it works great for you, but you know, you have all these people on the couch and blah 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 blah, you know what I mean? But send them to my video, or use some of the information in my video to not clap back, but clap back, you know? See if you can change their mind. See if you can break the stigma. See if you can help move this path down in the direction that we want it to, because at the end of the day, cannabis is not going to go anywhere, and we are going to continue to use it and continue to medicate and continue to bring this medication to the people that need it, regardless of the few that have a negative stigma about it. But when it comes to something as beneficial as cannabis, it's always worth it to try to break their stigma. Have a beautiful rest of your week, and thank you for coming to Terpene Tuesday. I hope that you join the family, and I'll see you next week. Mwah!